Good afternoon. This is Dr. Kaminsky at the Walla Walla Department of Community Health. Today I want to talk to you about COVID infection in pregnancy and the important role for vaccines in women who are wanting to get pregnant and in those who are pregnant. There has been some concern that COVID vaccines cause infertility, and there have been multiple studies on this. They've looked at groups of reproductive age women who have not been vaccinated and compared that to groups that were vaccinated. And the conclusions are that the COVID vaccine does not cause infertility or impair your future fertility. The studies continue to support the fact that COVID vaccines are safe and effective in this age group. And so we make a strong recommendation that women who are considering pregnancy in the future or currently pregnant to get vaccinated. Now, if a pregnant woman gets COVID during pregnancy, this can be a much higher risk situation than if she was not pregnant. And we see this scenario with other diseases, such as with influenza, for instance. We saw that a lot more women were requiring hospitalization and need for a ventilator with influenza. But even conditions such as getting a kidney infection, pregnant women have a higher risk for adult respiratory distress syndrome and sepsis. And so the pregnancy state is different than a non-pregnancy state. And likewise, we're seeing that with COVID, that if you get COVID while you're pregnant, you have an increased risk for severe illness, hospitalization, and even death. A recent literature review showed that there was an 18 times increased risk of a need to be in the ICU if you get COVID and you're pregnant, and there was a 3 times increased risk of death from COVID. It's much riskier to get COVID during pregnancy, and so it's important to get vaccinated, preferably before your pregnancy. But certainly it can be done during pregnancy safely as well. How can COVID disease affect the fetus? Well, there are some studies that suggest that there's an increased risk of preterm birth and stillbirth. Not all studies show this, but as the data is emerging, more and more studies are suggesting that there's an increased risk of preterm birth and stillbirth. And this can, especially stillbirth, can be a devastating outcome. There have been studies that have shown evidence that a fetus got infected with COVID in utero, but that's a rare event. But once you deliver, your newborn can get COVID, and as most of us know, a viral respiratory illness in a newborn can be a dangerous situation. So ideally, a mother would be vaccinated, and then her body would make protective antibodies, and those could cross through the placenta during pregnancy and afford the baby protection, but also can cross through the breast milk and give the newborn protection if they get exposed after their birth. COVID vaccines during pregnancy has been studied intensively, and it's still looked at very carefully. They started with animal studies with the COVID vaccine, and there were no safety concerns in animal studies. This was followed by clinical trials, and there were no adverse related pregnancy outcomes noted in these clinical trials. And we just want to remind people that this amazing technology does not cause an infection in your body, and that the mRNA vaccines do not affect or interact with your genes or your DNA. So in summary, the COVID-19 vaccine is recommended for all those 12 and older, including those who desire to get pregnant in the future, who are breastfeeding, who are currently pregnant. Studies show that the COVID-19 vaccine is safe and effective, and it's certainly safer to get vaccinated than to get COVID. There is no evidence to suggest that COVID vaccine causes future fertility problems, so we are recommending that reproductive age women who desire to get pregnant in the future or who are currently pregnant to get vaccinated. If you have more questions about this, certainly reach out to your primary care providers, your women's health provider, but this is also a resource here, a 1-866 number and a website where you can speak to an expert and get answers to your questions about COVID vaccine. So get vaccinated, stay safe, and take care. And we'll see you soon.